Hello and a very warm welcome to Rajya Sabha Television. You're watching COVID-19 India Fights Back. I'm Frank Rausan Pereira. Well, the country's apex health research body, ICMR, has issued an advisory stating that indiscriminate use of convalescent plasma therapy or CPT in coronavirus infected patients is not advisable. In an evidence-based advisory to address inappropriate use of convalescent plasma in COVID-19 patients, the Indian Council for Medical Research said that a potential donor for convalescent plasma should have sufficient concentration of antibody working against COVID-19. Benefits of CPT in improving clinical outcomes, reducing severity of disease, duration of hospitalization and mortality in COVID-19 patients are dependent on the concentration of specific antibodies in convalescent plasma that could neutralize the effects of SARS-CoV-2. CPT or passive immunotherapy has been tried in the past for treatment of viral infections like H1N1, Ebola and SARS-CoV-1, etc. In this edition of COVID-19 India Fights Back, we will analyze the status of plasma therapy. Joining me on the program today are Dr. Saurabh Mittal, Assistant Professor, Pulmonary Medicine, AIIMS, New Delhi; Dr. Aparna Mukherjee, Scientist E, Clinical Trial and Health Systems Research Unit, ICMR, New Delhi; and Dr. Meenu Bajpai, Professor, Transfusion Medicine, Institute of Liver and Biliary Sciences. Thank you to my guests for joining me on this edition of COVID-19 India Fights Back. All right, Aparna Mukherjee, let me start the program with you first. Let's first try and understand, the status of plasma therapy really, because a few months ago it was considered to be a great treatment, as far as COVID-19 is concerned. Now, with every passing day, there's new study emerging that it might not be as effective as it was initially thought out to be.
Plasma therapy was always and has been used, as you said, in the other diseases also as kind of a bridging therapy till we actually have more concrete, definitive therapy for any virus. There is biological plausibility, and that is why the clinical and the scientific community was so interested in using it. But unfortunately, we are having very mixed results that we are getting. From our own RCT, we could not find any clinically meaningful results. There are observational studies which are still giving some hope, but then you cannot really use it for everybody at every stage, and any kind of plasma cannot be used. We now know so far into the pandemic that we really have to be very careful regarding who we are transfusing to and from whom we are collecting the plasma if we really want it to work.
Right, all right. So, Meenu Bajpai, so how does one decide really, when to use it, when not to use it? Is it at the discretion of the doctors? Is that a standard operating procedure? How do you deal with such things?
The Division of the Ministry of Health and Family Welfare has given a clear-cut guideline that it should be used only in moderately sick patients, not in severely sick patients. And a very large observational study by the Mayo Clinic, I think it was more than 35,000 patients which they had collected data. They had said that if it is given early in the disease, it is beneficial. And the other thing is that the plasma should contain adequate amount of neutralizing antibodies. So these two factors are very important when you're looking into this as a treatment. If you're going to give it late in the disease, when the patient has already developed antibodies, it is not going to give any additional benefit, that is for sure. So one of the very important points that the recent advisory by ICMR has said is that the patient, you should do antibodies in the patient and not be given to patients who have already developed antibodies. At the donor end, I've been in charge of the Delhi Plasma Banks, which is started since July under the mentorship of Dr. S.K. Sarin, who is the director of ILBS. We have been collecting plasma, and we have collected over 3,000 units. And for every unit, we have been doing IgG antibodies and neutralizing antibodies. And we only issue plasma which has adequate amount of neutralizing antibodies.
Right. Okay. So, Saurabh, Mittal, let me bring you into the picture now. As far as this plasma therapy is concerned, what has its impact or effect been in the past on when it has been used for other diseases? Are there any side effects? Are there any issues? Are there any challenges that come up when we use plasma transfusion?
So if we look at the plasma therapy, convalescent plasma therapy, before the COVID-19 pandemic, the use was there, but it was never at a larger scale. So right now we are dealing with the pandemic, and there is a huge number of patients who are undergoing plasma therapy as compared to the previous epidemics where the number was less. Even in those epidemics, it was not shown to be highly beneficial. The problem once we started using plasma therapy was that at the time there was nothing which we could use. So initial pandemic, April, May, the plasma therapy was taken as a boon, and then it was taken that it is going to change the face of this pandemic and cure a large number of patients. Obviously, ICMR started its trial at the same time. Eventually, the results did not come very favorable. The patient outcomes actually vary depending upon at what stage you started the therapy. In initial phases, most of these patients were receiving it late because previously physicians were very unclear what to do. And by the time patient has already undergone 7-8 days therapy, then a plasma was given. But later on, the understanding came that earlier use probably is beneficial. Secondly, it was being used, or it is being used because it is safe. There are really no major side effects associated with convalescent plasma therapy. So that's why it was adopted very early by the clinicians for its clinical use.
Okay. So this is, the status really as far as CPT is concerned. And since we are here now, Aparna Mukherjee, the advisory clearly does not state that, CPT can't be used at all, but it has to be used only in certain cases. What are those certain cases and when can it be used?
Yeah, right. Like Dr. Saurabh and Madam pointed out, it has to be with more understanding of this disease. We have come to realize that we just cannot indiscriminately use it for anyone and everyone. It has to be early in the disease. And early would mean very early, that is 3 to 5 days from symptom onset. And at the most that we are saying is 7 to 10 days. That might also be sometimes too late because the patients themselves start developing antibodies by that time. And so just stopping it up from outside may not be helpful. And the second thing is you need to give plasma which is rich in antibodies. It really should have adequate amount of not only positive antibody, not only just a small amount, but it should have adequate amount of neutralizing antibodies to be helpful.
All right. So since we are here then, Meenu Bajpayee, since we are talking about antibodies, since we are talking about donors as well, so when does someone decide to go ahead, or when would it be adequate or an appropriate time for a donor to go ahead and give out plasma? That is one. Secondly, till when can it still be useful, and till when can it have adequate number of antibodies?
Yes, that's a very good question. Usually from the date of positive, the patient was positive, or in a patient who was having very mild symptoms or asymptomatic, or at least 14 days from the day of recovery. That is the time when you can donate, you're eligible to donate, is 14 days from recovery. Okay, and the antibodies are usually present up to 3 months. So between this duration, you can come and donate. And when you do come here to donate, you would be screened initially for your IgG antibodies. Those having adequate IgG antibodies would only be taken, and the rest would not be eligible to donate. So nowadays we have chemiluminescence assays which give results in 30 to 40 minutes. So it's easy to screen donors for antibodies initially.
Right.
And later on you have to do neutralizing antibodies also, which would take a little more time.
Sure. Okay. So let's broaden the scope of the discussion now and bring in a few more aspects as well. Let's talk about moving forward. Saurabh, Mittal, in your opening remarks, you spoke about how, plasma therapy was seen as something that could change the face of the pandemic, but that's not something what it has resulted in. What is it that can change the face of the pandemic going forward?
So if you ask me, the only thing which can change the face of this pandemic is masking, universal masking. Right now, if you see the condition of Delhi specifically, you see the roads are full and people are not using masks as they should be. And you see the graph which is going that every day the numbers are skyrocketing. So the only thing which can change that you have to be slow. So only masking can change. Regarding the drug therapy, the widespread availability of oxygen therapy, better understanding and training of the peripheral doctors, as well as the steroid therapy. So those are the 2-3 things which can actually change the outcome of this pandemic.
Right. Okay. So, Aparna Mukherjee, going back to a point that Meenu Bajpayee was making about, how the antibodies stay in the system for about 3 months, considering that this pandemic has been around now for, several months in India, at least from February onwards. If you look at it, it's about 8-9 months. And, despite that, the number of reinfections that we've seen are very limited. You can count them on the tips of your fingers, in fact. And why is that so, do you think?
Well, the antibody kinetics is something that we are gradually understanding, that and on an average, we expect that it would stay for about 3 months, but there will be always variations, individual variations. And it is not only the antibody that might be at work when you're talking of immunity against the virus. There might be the, T-cell immunity. That's the other part of our immunity that might as well be effective. So these could be the causes that really is behind the phenomenon that we are not really seeing reinfection that much, even though we are still almost a year into the pandemic.
Right. So, Meenu Bajpayee, does it also have something to do with the strain of the virus that could be here? Also, there are several studies that people are conducting, all around the world and within India itself, talking about how, we don't seem to be as susceptible as the West as far as the COVID-19 vaccine is concerned. Yes, it is still dangerous. Yes, it is still fatal. But we seem to be faring far better than many of the other countries.
There have been so many reasons propounded for this slightly lower mortality rate, basically, what you would call the mortality rate of the coronavirus infection in India is slightly lower than what you see in the West. But if you see the population graph, India has a lower population on the elderly side, a lower population. And plus, yes, of course, the immune factors may be there. We are more exposed because of the lower levels of hygiene. We are more exposed to multiple viruses and bacteria and maybe developing a more robust immunity. So it might be there, but nothing to be proven. But yes, these could be the factors. Besides, I want to answer a question which you did not ask me, that regarding the mask. When you go out into the market, a lot of people are wearing masks, but most of them are wearing it wrong. So once you have a mask on the face, you won't get challaned. Nobody will call you out on it. But a mask, if you're wearing a mask, it should be at least a 3-ply mask. It should cover the nose. It should cover the face. It should not be pulled down when you're talking to somebody, which is the point at which you're going to transmit the most. So besides just saying that you should wear a mask, I think how you wear a mask is very important in preventing further spread of the pandemic. And I think that is one of the most crucial factors, and it should be bought in by everybody, that how to wear, the correct way to wear a mask.
I think that's extremely important. That's something that we need to look at as well as far as the mask is concerned, because right now that is the most potent weapon we have against the coronavirus at this juncture and at this point. Till the time we probably have some kind of a cure, treatment or vaccination, that's the best thing that we can do. Follow these simple steps of wearing a mask, washing your hands as often as possible, and also ensuring that you maintain physical distancing. That's still the best way to fight the virus. Talking about fighting the virus, Saurabh, Mittal, let's not forget that the virus attacks the lungs mainly, and from there on it causes various other problems. What have we learned so far as the virus is concerned, and how we can manage it once someone is already infected?
Right now, what we have learned, wiser, are that number one, that oxygen therapy works well. We do not really need high-end drugs. There was a lot of discussion on tocilizumab and other antibodies and high-end drugs, but they really did not benefit. Even remdesivir initially was thought that it may be very useful, but it is also not like you should take it as a Ramban drug for treatment of COVID. No. So what we have learned that the basic precautions were basic understanding of managing the oxygen therapy, as well as giving steroid for patients who are on oxygen, as well as because a lot of patients develop thrombosis, clots in their veins. So third thing is the use of anticoagulant, that means blood thinners. So those are probably the three most important things which work for these patients who have been infected. And another thing is the prone positioning, means patients are asked to lie down on their abdomen rather than on their back, because at that point of time, the lungs, which are dependent portions, are also getting better ventilated and oxygenation is improved. So those are the 3 or 4 things which remains the cornerstone of therapy even after 7-8 months into the pandemic in India.
Absolutely. And, Aparna, Mukherjee, from a clinical point of view, from a research point of view, what is it that the pandemic has taught us so far? Because, every passing week, we seem to be learning something new. We seem to be unlearning a few things as well. So the pandemic certainly has taught us a new way of life, but it has also taught us many other things from a clinical and a research point of view.
Yes, I mean, this has been a huge learning curve for the scientific community, for the physician, as to how to treat a novel virus and a novel disease. And every day, as you said, we are learning and unlearning some things. But at the heart of it, it remains, as Dr. Mittal said, that it is the supportive management, the oxygen, and how you manage the respiratory problems. That is what is the cornerstone of treatment. We really don't have any miracle drug which can cure it, and I don't suppose there will be any miracle drug that is going to cure it. So it has to be the supportive management which has to be strengthened, oxygen and positioning and ventilation, that has to be strengthened to actually fight it. And obviously prevention is the best cure, as everybody say. Put up your mask and put it up properly, not use it as a beard, but as a proper mask. So that will go a long way.
Absolutely. Meenu Bajpayee, since we are here, let's take some points of view from you as well as to what are the biggest lessons that you've learned and your community has learned really as far as the pandemic is concerned.
One of the most important things is that prevention is always better than cure. We have not still understood the whole spectrum of the symptoms and the effects of COVID-19 on the body. And there are some long-term effects. So at every point of time, the best treatment is when you don't have to treat, that is prevention. And that is the real take-home message, that masking, social distancing, and avoiding gatherings, which, there has been repeated emphasis by the government on avoiding gatherings. But that is also, there's a lot of problem with that area, with festivals coming up every now and then. And we have Kerala's example, post-Onam, and something which is being repeated in Delhi. So we have to persevere. We don't have to go into COVID fatigue, as we call it, and keep our masks in place and our behavior in place regarding social distancing. These are the only simple messages, but they hold a lot of promise.
Saurabh, Mittal, since Delhi came up, let's talk about Delhi as well. As far as Delhi is concerned, the numbers in Delhi seem to be extremely alarming, especially over the last couple of weeks or so. What's gone wrong in Delhi, and can we bring the situation under control? What needs to be our focus? How much of an impact has the foul air also had on the rise or the number of cases going up?
So problems in Delhi have been multifold. Number one is the pollution. That if you see the AQIs over last 2 weeks versus what it was in March to June, you will see that there was a huge increase. Number two, the temperature has gone down. So we also did a study which is recently published. We saw that once the temperature actually decreases, the spread of the disease is exponentially rising. So that was seen in other countries. But if you look at Delhi, the temperature variation in Delhi is very high. It means we go to 10 degrees in winters and we go to 42 in summers. So the temperature variation is too much. And if we see this much temperature variation, the spread of disease is likely to increase during the winters. So that is the second point. And third is obviously that people are now what we call COVID fatigue, that people are getting tired of sitting in home and working well, so they just want to get out. So that is third thing which we can actually prevent, that people need to reduce their mobilization, they need to continue to follow the measures. So those are the three important things which probably has led to this worsening in Delhi specifically.
Okay, time now to get closing comments from all my panelists with the best way forward. Starting first with you, Aparna Mukherjee.
Yeah, the best way forward, as we have been harping again and again, avoid gathering, put on your mask, wash your hands, keep your distance from each other. I mean, this virus is not going anywhere very soon, so we have to learn to live with it, and prevention is the best cure. So we have to strive for that.
Meenu Bajpayee.
The message is the same. You have to persevere. We have to get through this phase. Vaccine may come, but it will also not be something magic. We'll still have to wear masks, and I'm looking up to wearing masks for maybe a year or more in the future. So keep it up on your face.
Absolutely. So this is something that we've learned over the last 7 or 8 months. This is something that we have to learn to continue to do for the next year and a half or so. And only together we can fight and battle this virus, is what the panelists are very clearly and very loudly saying and suggesting. Saurabh, Mittal, close the show for us with your concluding remarks.
So what we have learned probably is that there is no magic bullet for the virus. So patients who are getting the disease, they should understand that a large portion of them will improve. There is no need to fear. So you should not fear, but you should prevent. It should not happen that people go into depression, psychosis, because they may worry that they got the virus or they may spread the virus. But people need to learn to live with the virus, and probably that's the best strategy forward.
All right. On that note, then, I'll call it a wrap on this edition of COVID-19 India Fights Back. Thank you to all my guests for joining me on the program and putting things into perspective for us. Before I leave, we'd like to make an appeal to all our viewers to just follow these few steps to defeat the coronavirus. Ensure that you wear a mask whenever you step outdoors. Wash your hands and your face regularly, and ensure that you maintain physical distancing of at least 6 feet. These small and simple steps can go a long way in defeating the pandemic. That's it from me. See you again next time.